Hi, Raymond here, one of the physiotherapists at the Brisbane Spine Clinic in North Lakes. Today's video, I'll be discussing what to expect from a physical therapy or recovery perspective from spinal surgeries. I'm not going to be detailing the specifics of each surgery that there is, but more about the key principles in the recovery stages. Preparation for the surgery can begin much before your admission into the hospital. This is where, as physiotherapists, we can implement the Prehabilitation or Prehab, where we can manage your symptoms, improving or maintaining range of motion, as well as maintaining or improving the strength and endurance of the muscles to make sure recovery after spinal surgery proceeds much quicker. The rehab process post-spinal surgery is usually split into 3 different phases. Now, each phase will dictate when we can do certain things and when we can implement certain exercises, and the timeframes of each phase may depend on the type of surgery that you receive, as well as your doctor's protocols. But again, I'll be detailing some of the key principles of each of these. The first phase is the protective phase, and most often this can go from 0 to 2 weeks post-date of surgery. The next phase is the initial strengthening phase, and this can go from 2 weeks to up to 6 weeks post-date of surgery. And then the advanced strengthening phase, which is usually 6 weeks and can vary from 8 to 12 weeks post-date of surgery. In the protective phase, we want to protect the surgical site by reducing the pain and inflammation in the area, by limiting our movements and learning proper body mechanics when it comes to getting up out of bed or getting up in and out of chairs, as well as introducing gentle core and glute exercises. We also want to make sure our cardiovascular health is maintained, so we want to implement a exercise program where we're trying to target 10 minutes twice a day for walking. In this phase as well, we want to avoid any heavy lifting. The amount of weight that you can lift will be dependent on your doctor's protocol, and this can vary from about 5 to 10 kilos up to 20 kilos. In this stage, we also want to limit the times that we're sitting down. So this will usually be capped at about 30 minutes for a total in terms of the time that you can sit, making sure that we're taking standing breaks whenever we can, and again, walking as much as we can. Next is the initial strengthening phase. In this phase, we're going to be progressing our exercises to be a little more challenging for yourself, as well as implementing more of a 30 minutes of cardiovascular health exercise. Now this can be, again, walking. This can now be upright bike or recumbent bike use, and potentially aquatic physical therapy if the doctor is okay with that as well. In this phase, we're still going to be implementing more of the 30 minutes maximum of sitting at a time, but our lifting restrictions can be eased depending on the doctor's protocol, on the weight capacity that we can start to lift. Then we'll have the advanced strengthening phase. The advanced strengthening phase will run from 6 weeks post-date of surgery and can vary from 8 to 12 weeks post-date of surgery, depending on what type of work or what type of sport you're trying to return to. In this phase, as the name suggests, we'll be advancing your exercises to a lot more similar to what you'll be doing at your work or even to your sport, and implementing a little bit more of a educational program to make sure that you understand when the flare-up is occurring and making sure that you're stepping back whenever you need to prevent any further issues to develop. With that, depending on your sport or depending on the intensity of your sport, the doctor's protocol may change when we can implement the running or even sport-specific exercises for yourself. So we'll be keeping in touch with your doctors to make sure we're implementing these at the right stage. So that sums up what to expect from the physical therapy or recovery process of a spinal surgery. If you are experiencing any sort of acute back pain or chronic back pain, please do book in with us so one of our physical therapists can get you properly assessed and getting the proper treatment that may help you getting back to doing what you love to do. See you soon.